Hello everybody and welcome to WIXUR podcast.
Dental tourism and top 10 dental tourism destinations. With the constantly rising cost of healthcare, many Americans and Canadians are making difficult decisions about their health, including sometimes forgetting routine preventive care as a way to save money. This includes dental care, which can result in patients requiring even more expensive and complicated emergency care down the road. One way that many Americans and Canadians are choosing to save money on costly dental treatments is by traveling abroad to have the work done for less. Medical and dental tourism has occurred throughout history, and today it's as popular as ever. An entire industry revolves around connecting patients with care in other countries. However, patients should consider several important questions before taking a trip to a foreign country for any kind of dental treatment. First of all, do the cost saving outweigh the risk of entrusting a dentist in another country with their own oral health? Or what research should they perform to find the right dentist? And for dentists who hear patients expressing interest in dental tourism, what advice can they give to help ensure the best possible outcomes? But what are the reasons to seek treatments abroad? Medical and dental tourists travel to other countries for a few reasons. According to the Centers for Disease Control and Prevention, CDC, some may be immigrants who wish to travel back to their home countries for care. Others travel because a certain procedure or treatment is not available in their country. Many others go to a specific treatment because the costs are significantly less. The CDC reports that most patients travel to other countries seeking cosmetic or plastic surgery and dental care and heart surgery. How much can patients really save? According to Patient Beyond Borders, a company that researches medical procedures in other countries in order to inform medical tourists, the top 10 destinations for dental tourism among US are Mexico, Thailand, Hungary, Spain, Poland, Costa Rica, the Philippines, Malaysia, Turkey, and the Czech Republic. US patients can expect to save 40 to 65 in Mexico, 45 to 65 in Costa Rica, and 50 to 75 in Thailand. How is it possible for patients to save so much money in these countries? In a country like Mexico, the cost of living is significantly less compared with the United States and also Canada, making it much more feasible for dentists to own and operate a practice. In addition, dentists in Mexico are not required to pay for malpractice insurance. Mexican dentists also carry less student loan debt in comparison to the US dentists due to the government subsidies. They repay these subsidies with 1 year of free service after school. Many patients combine dental care with a vacation. News media is filled with testimonials from patients who save thousands of dollars by seeking dental care in another country while they are on vacation. With the increasing popularity of dental tourism over the past 10 years, companies have been created to research and plan trips for medical tourists. Companies like Patients Beyond Borders and Dental Departures connect patients to international healthcare providers through marketing services. According to its website, Patients Beyond Borders is a resource for patients and healthcare professionals. Founder and CEO Joseph Woodman states that he has spent more than a decade researching and vetting international options for quality, affordable medical care, which also includes dental care. Potential medical tourists can consult with companies like this to select reputable clinics. Some of the criteria that companies use to vet healthcare sites include being accredited by a reliable, globally recognized organization, and being in a good legal standing, and also having a website in English and listing key physicians on its website. Having identifiable services offered to patients is also another important factor. Dental tourism is broader than just North America. People in other countries are also traveling for dental care. The practice is also common in Europe. Britons often travel to Hungary, Slovakia, and Poland for lower prices. Irish people go to India, the United Arab Emirates, Malta, and Turkey. Many European countries are publicizing their desire for patients from countries with higher costs of living. Both Poland and Croatia have spent millions developing public relations campaigns promoting their medical tourism. It appears to be working. Medical tourism in Europe has been growing 12 to 15% annually. US citizens can also take advantage of these European markets. With a valid US passport, patients can visit any country in Europe's Schengen area for a duration of up to 19 days without requiring a visa. The Schengen area includes 3 of the top 10 global dental tourism countries, Hungary, Spain, and the Czech Republic. While in Europe for dental treatments, US dental tourists can also travel to other countries in the Schengen area as part of European vacation. Dentists may encounter patients who are interested in dental tourism. While they should not immediately discourage the idea, all dentists should insist on one central point: do your research. The CDC advises anyone seeking healthcare out the United States to do true research about medications, infection control, and antibiotic resistance bacteria. They should also investigate the standards by which facilities are measured in order to be accredited by organizations such as Joint Commission International, DNVGL International Accreditation for Hospitals, and the International Society for Quality in Healthcare. If something goes wrong, patients must also be aware of the options they have to obtain the retreatment, manage post-treatment, and also the complications, or pursue refunds and restitution. Some countries have ministries of health, others have different forums for complaints. It is very important for patients to stick to the facts and not to be enticed by marketing. When a patient expresses interest in dental tourism, it is an important opportunity for US and Canadian dentists to demonstrate their value as patient oral health advocates. Traveling abroad to receive cheaper dental care is certainly not a decision many dentists will agree with. However, for some patients, dental tourism may be inevitable, serving as a resource for expert advice and stressing the need for proper research before the trip, and also being proactive in requesting treatment records upon the patient's return will all help maintain the patient relationship.